So we'll quickly look at the best course outline for studying peritonitis. And peritonitis, everybody already know. Peritonitis is what? The inflammation of the peritoneum. Okay, so if the peritoneum is inflamed, that's when we say there's what? Peritonitis. All right, take note of this. Anytime you see itis, means what? Inflammation is actually what? Taking place. All right. So for the inflammation of the peritoneum, we say this is a normal digestive system. Then inflammation of the peritoneum, all right, basically that shit covering the digestive system, all right, is what we are trying to study. So we'll go through defining it. After we define, then we look at the possible best course outline for studying peritonitis. So first of all, we say that peritonitis is what? Inflammation in your peritoneum. Okay, and the peritoneum is the what? The tissues that lines the inside of your abdominal cavity. All right. So now it is usually caused by an infection and sometimes by what? Irritating bodily fluid. All right. Now infections in your peritoneum is what? Especially dangerous because what? It can affect your abdominal organs because this like the tissue lining everything. Okay, so there's an infection, the infection can spread. Let me say there's infection, there's inflammation, it can actually spread to what? The abdominal organs. All right, so if it spread there, there's always a problem. So let's look at the course outline. First of all, we look at the definition of the concepts, which we have already, not really. Okay, we have a special video defining it and saying other things, sort of like an introduction to peritonitis. Then we look at the types of peritonitis. Um, we look at the different types. Okay, so the different types are grouped into primary peritonitis, secondary peritonitis. Then we'll still look at the secondary peritonitis in details, right? We'll look at the differential diagnosis for peritonitis. We'll look at the various investigations that can be done for peritonitis. That's what? Investigations to confirm that peritonitis is there, that's diagnosis. Investigations to stage, to know the extent of the disease condition. Then also investigations to treat. All right, so look at all of that and look at the effects of peritonitis. That's basically the signs and symptoms, right? We look at the treatment principles. They'll look at the prognosis of the disease condition. Prognosis is basically what the likelihood of the possibility of a patient recovering from the disease condition. That's what we call what? Prognosis. So that's what we'll be doing under this series of peritonitis videos. All right, catch you guys.